Today we gather to ignite your transformative ideas into tangible realities.
20% of America, 75 million Americans live in rural markets dealing with inadequate health care. And there's many reasons for that. And that's what we're excited about at our centers, because we're addressing a major unmet healthcare disparity called rural medicine.
Rural communities are kind of their own entity. A lot of times they feel like they're just out there and nobody's really paying attention to them. They're not getting access to resources, and they're all in it together. So the fact that they can come together and convene and know that they are a united voice, and it makes them a very strong group and gives them a space to share that together. I think that they can see that they're not alone. It makes them feel better that they're not living in the silo of their rural community, that they can connect and have each other as a network and a resource and kind of as a mentor.
Let me ask this. If you were left alone in a room with a white piece of paper and this topic, how many of these ideas would you have come up with?
One of the things that really helps with doing this method of brainstorming is that it gets people out of the mode of thinking what won't work. Everyone has this vault of information in their head about things that haven't worked in the past and reasons they've been told no and political barriers and everything in the world. But if you just take a few minutes to say, what if anything was possible, it unlocks this creativity that everyone has. And everyone here has such great expertise. It's like saying, what if you didn't have any barriers? What could you do? What would your dream be? And that's important because there's a huge difference between impossible and really, really hard. Few things are actually impossible.
It works to actually transform. A lot of innovation challenges are what's the tech app or a whiz bang that you can pull together in a day or two. We challenge people months in advance to bring their best ideas and to compete for award dollars, to transform ideas directly into real, tangible programs and services within their communities.
Our 2024 Rural Health Innovation Challenge categories surrounded the Oklahoma State Health Improvement Plan. The plan is in its developmental stages, and we saw this as a really excellent opportunity to align with the State Health Improvement Plan, challenge our communities to think about how they could create solutions in the areas of diabetes and obesity, cardiovascular risk reduction, mental health and substance use disorders, and the social drivers of health.
So one of the things that's wonderful about these kinds of events is you bring together the frontline practitioners from throughout the state who are focused day in and day out on the challenges of rural medicine, and they're bringing their major challenges and most vexing problems to us to allow us to focus our innovation efforts on those things that are most relevant and most pertinent to the rural practitioners in the market.
It benefits all of us. It benefits our health outcomes, whether you live in an urban or a rural setting. It really impacts our healthcare spending, urban or rural settings. So it really does create a very intentional alignment with innovation, our state health improvement plan, and our state health equity plan.